I am here today to represent my colleagues who work in health facilities across the state, both public and private. We are the ones on the front lines, and we strongly support Senate Bill 1313, an act requiring healthcare employers to develop and implement programs to prevent workplace violence. Violence across the country and against healthcare workers is on the rise. A 2015 report from the Centers for Disease Control found that between 2012 and 2014, incidents of violence nearly doubled for nurses and nurse assistants. Violence against healthcare workers accounts for nearly as many injuries as in all other industries combined. That is a rate 5 times greater than the average worker in our country, with more non-fatal incidents of workplace violence than against police or correctional officers. My colleague Kathy Metzger, who is here today, will speak to a recent survey demonstrating how bad the problem is in Massachusetts. But this isn't just about data, though there is much data that is available to support this legislation. This is also about people. My colleagues and I have experienced a broken collarbone, a whiplash injury from being jerked around by the hair with such force that the staff member was unable to return to work for almost 1 year, a strangulation that came close to death, a kick to the chest that resulted in back spasms, bruised ribs, and the need for months of physical therapy, a nurse colleague who was punched repeatedly in the head just after narrowly being avoided being hit over the head with a chair. Another member of my staff sustained a concussion as a result of being attacked without warning and repeatedly punched in the head. Another suffered the permanent loss of her peripheral vision in one eye. And yet another colleague suffered a broken jaw. I have 6 colleagues who will never return to work because of the trauma they experienced in just my workplace alone. Similar incidents are happening every day in hospitals across the state. Every day, patients and healthcare providers are increasingly put at risk by workplace violence. A hospital should be a place where a patient can go to heal, and nurses and other healthcare providers can provide care in a safe environment. Unfortunately, hospitals are growing increasingly violent for both the employees and the patients. This bill takes steps forward to making hospitals safer by requiring those employers to perform annual risk assessments and identify factors which could place their employees at risk for workplace violence. It requires them to look at factors like working hours, staffing levels, public access to areas, working in high crime areas, and any other factor that might affect safety. Hospitals would then need to write and develop a written violence prevention plan and put measures in place to minimize those risks. The bill also requires the creation of an in-house crisis response team to support the victims of workplace violence. This is extremely important because in addition to just the physical injuries alone, victims often suffer emotional trauma and anxiety associated with returning to work. You'll hear today from nurses who have experienced both of those. A good step was taken by the legislature 5 years ago to protect healthcare workers when an act relative to assault and battery on healthcare providers was signed into law. Now we must take the next step in protecting nurses, putting a plan in place that will prevent violence in our hospitals. I strongly encourage the Committee on Public Safety to support this legislation and help to ensure that hospitals are a place of healing and peace, not violence. Thank you for your time.